Your doctor checks your fasting blood sugar every few months and hands you that little printout. And every time, that number is higher than you want it to be. You've tried cutting back on sugar. You've watched what you eat. Maybe you're even on medication. And still, that morning blood sugar reading keeps climbing. What if there's something so simple, so inexpensive, that you could do every single morning before breakfast, that multiple clinical trials have now shown can meaningfully reduce your fasting blood sugar? Not a supplement, not a prescription. Something sitting in most kitchen cabinets right now. Today I'm going to walk you through the science of exactly what it is, how it works inside your body, the precise way to use it, and who absolutely should not try it. Because this isn't one size fits all, and I want you to have the complete picture. I'm Dr. Sarah Mitchell, and this channel is dedicated to bringing you the latest evidence-based health research, translated into clear, practical information designed specifically for people over 60. If that sounds like something you want more of, hit subscribe and tap the bell so you don't miss what's coming next. Now let's get into it, because what I'm about to share with you genuinely changed how I talk to my patients about blood sugar management. The drink is apple cider vinegar diluted in water, taken every morning before your first meal. That's the answer. And before you roll your eyes, because I know some of you just did, I want you to stay with me for the next several minutes, because the science behind this is far more compelling than most people realize. This is not folk medicine. This is not your grandmother's home remedy with no evidence behind it. A 2025 meta-analysis published in Frontiers in Nutrition, one of the most respected peer-reviewed nutrition science journals in the world, analyzed 7 controlled clinical trials involving 463 participants with type 2 diabetes. The results were striking. Apple cider vinegar significantly reduced fasting blood sugar by an average of nearly 22 milligrams per deciliter. That is a meaningful, measurable, clinically significant drop. The same analysis found that HbA1c, which is your 3-month blood sugar average, the number that really tells your doctor how your body is managing glucose over time, dropped by an average of 1.5 points. For context, a 1-point drop in HbA1c is often enough to move someone from a diabetic range into a pre-diabetic range, or from pre-diabetic into normal. 1.5 points is genuinely significant. This was not one small study conducted by researchers with a financial stake in selling you something. This was a rigorous analysis of multiple independent studies, graded using the grade system, which is the gold standard that medical professionals use to evaluate the reliability of clinical evidence. Now here's what most people don't understand, and this is where it gets really interesting. The mechanism. Why would vinegar have any effect on blood sugar at all? It seems strange, doesn't it? You drink something sour and somehow your blood sugar goes down? But the explanation actually makes a lot of sense once you understand what's happening inside your body. When you eat carbohydrates, bread, potatoes, fruit, rice, your digestive system breaks them down into simple glucose molecules. That glucose floods into your bloodstream, and your blood sugar rises quickly. Your pancreas senses that rise and releases a hormone called insulin. Insulin works like a key. It fits into locks on the surface of your muscle and fat cells, opening the doors so glucose can move out of the blood and into the cells, where it gets used for energy. The problem in type 2 diabetes, and even in pre-diabetes, is that those locks have become stiff. They don't turn as easily as they should. This is called insulin resistance. Your pancreas pumps out more and more insulin trying to force those doors open, but the glucose still can't get in efficiently. Blood sugar stays elevated. The pancreas keeps working overtime, and over years, elevated blood sugar silently damages the small blood vessels that feed your kidneys, your eyes, your nerves, and your heart. Apple cider vinegar appears to help with this problem through several mechanisms working simultaneously. The primary active compound in vinegar is acetic acid. Acetic acid does something remarkable. It slows the activity of specific digestive enzymes called alpha-glucosidases, which are responsible for breaking down complex carbohydrates into glucose in your small intestine. Think of those enzymes like a crew of workers rapidly converting carbohydrates into sugar and handing it off to your bloodstream. Acetic acid tells part of that crew to slow down. The result is that instead of a sharp, rapid spike of glucose hitting your blood all at once, The sugar enters more gradually. Your pancreas doesn't have to scramble to produce a massive burst of insulin. The whole system gets a chance to keep up. This is essentially the same mechanism used by prescription diabetes medications called alpha-glucosidase inhibitors, like acarbose. Except those are drugs, and acetic acid is what you find naturally in vinegar. But there's more happening than just that enzyme slowdown. Research published in the European Journal of Clinical Nutrition found that acetic acid also appears to improve how sensitive your muscle cells are to insulin. Those stiff locks on the cell doors become more responsive. Glucose gets taken up more efficiently, even with the same amount of insulin. This is directly addressing the root problem in type 2 diabetes, not just masking it, but working on the actual underlying dysfunction. And there's a third mechanism that's particularly relevant for people struggling with their morning fasting numbers specifically. Several studies suggest that acetic acid may help suppress glucose production in the liver overnight. Your liver is essentially a glucose factory. It stores glucose as glycogen and then releases it back into your bloodstream between meals and overnight to keep your blood sugar from dropping too low. In people with type 2 diabetes, that factory often overproduces. It releases too much glucose at night and in the early morning, even when blood sugar is already perfectly adequate. This is called hepatic glucose overproduction, and it's one of the primary reasons fasting blood sugar is elevated in so many diabetic patients. Acetic acid appears to dampen that overproduction, signaling the liver to hold back some of that overnight glucose release. The result is a lower morning number before you've eaten a single bite. That's why it particularly helps fasting blood sugar, that number you see first thing in the morning before you've eaten anything. Comment below right now. What is your typical morning fasting blood sugar reading? Just drop a number. I want to see what our community is actually experiencing, because it helps me understand what topics matter most to the people watching. Now I want to explain the dawn phenomenon, because this surprises a lot of my patients, and it may explain why your morning reading frustrates you. Many people find that their fasting blood sugar in the morning is actually higher than their reading 2 hours after dinner. That seems backwards, right? You haven't eaten all night, so shouldn't your blood sugar be at its lowest? The answer is no, not if you're experiencing the dawn phenomenon. In the early morning hours, roughly between 3 and 8 in the morning, your body naturally releases a wave of hormones: cortisol, growth hormone, adrenaline. These hormones are designed to prepare you to wake up and be active. They signal your liver to release stored glucose into your bloodstream to give you energy for the day. In a healthy person, insulin quickly handles that glucose release, and blood sugar stays in a normal range. But when insulin resistance is present, your body can't efficiently manage that liver dump of glucose, and you wake up with an elevated reading that has nothing to do with what you ate for dinner. The dawn phenomenon affects a significant number of people with type 2 diabetes and prediabetes, and it tends to become more pronounced as we age, and our insulin response slows further. This is one of the reasons why the timing of the apple cider vinegar drink matters so much. The research that showed the strongest results used vinegar either before bed or first thing in the morning on an empty stomach. The pre-breakfast timing appears to blunt that early morning glucose release from the liver and prime your muscle cells to handle the carbohydrates from your first meal more efficiently. You get a double benefit: better morning fasting numbers and better post-meal numbers throughout the day. Let me tell you about Margaret. She came to see me at 71 years old, frustrated and a little defeated. Her fasting blood sugar had been hovering between 145 and 165 milligrams per deciliter for 2 consecutive years. She was already taking metformin. She had dramatically reduced her carbohydrate intake, and her doctor had recently started mentioning the possibility of adding a second medication. She wanted to try something evidence-based before going down that road. We discussed the research together, talked through the potential risks, and how to monitor safely, and she committed to a consistent morning routine for 12 weeks. She also started a 15-minute walk after dinner, which is independently supported by research as a blood sugar management tool, and slightly reduced her evening starch portions. At her next blood draw, her fasting blood sugar had dropped to an average of 118. Her HbA1c came down from 7.9 to 6.8. Her physician was satisfied enough to defer adding the second medication. Margaret still does the morning drink every single day. She says it takes her 30 seconds and costs less than $1 a week. Now, before I give you the exact protocol, here is what shocked me most when I reviewed the complete body of research on this. The 2023 randomized controlled trial, the strongest type of clinical study, published in Frontiers in Clinical Diabetes and Healthcare, followed 80 patients with type 2 diabetes for 8 weeks. The group taking 30 milliliters of apple cider vinegar daily saw the expected drops in fasting blood glucose and HbA1c. But the researchers also found something they hadn't primarily set out to measure: LDL cholesterol. That's the type of cholesterol most associated with arterial plaque and heart attack risk, dropped significantly in the vinegar group compared to the control group. Total cholesterol, and the ratio of bad to good cholesterol, also improved meaningfully. The control group, who followed the same dietary recommendations without the vinegar, did not see those lipid improvements. This matters enormously for people over 60, because type 2 diabetes and cardiovascular disease are closely linked. High blood sugar damages the inner lining of artery walls, making them more vulnerable to cholesterol deposits. Inflammation increases throughout the vascular system. The cumulative risk of heart attack and stroke rises substantially. Finding a single daily habit that appears to address both blood sugar control and cholesterol levels simultaneously is genuinely significant. I also want to be completely direct with you about the limitations of this evidence, because you deserve honesty, not just enthusiasm. The 7 studies included in the major meta-analysis ranged from 4 to 12 weeks in duration. Most were conducted outside the United States, primarily in Iran, Tunisia, and Pakistan. The total number of participants across all studies was 463. Meaningful, but not the same as a large multi-center American trial with thousands of participants followed for years. The evidence quality, when graded using grade criteria, was rated as low to moderate for some outcomes, meaning we can't make absolute guarantees. Apple cider vinegar is a supportive tool with real biological mechanisms and real clinical data, but it is not a cure, and it should not be used as a reason to stop or reduce medication without your doctor's direct guidance. Have you tried apple cider vinegar before, either for blood sugar or for anything else? Comment below and tell me what you noticed, positive or negative. Your experience is genuinely valuable to the other people watching this video. Now let's talk about who should not use this approach, because this is just as important as everything else I've told you. If you have been diagnosed with gastroparesis, delayed stomach emptying, which is a complication that can develop after years of poorly controlled diabetes, acetic acid can make that condition worse by further slowing digestion. Do not use this approach if you have gastroparesis without first discussing it with your gastroenterologist. If you have chronic kidney disease, particularly stage 3 or higher, your kidneys may struggle to process the acid load over time. If you have a history of acid reflux disease, a hiatal hernia, or stomach ulcers, undiluted or even diluted vinegar can be irritating and could aggravate those conditions. Always discuss with your doctor first. There are also medication interactions that you need to be aware of. Apple cider vinegar can interact with diuretics, which are water pills commonly used for blood pressure and heart failure, because both can affect your body's potassium levels. Potassium is critical for heart rhythm, and too little potassium is dangerous. If you're on a diuretic, your doctor needs to know before you add a daily acidic drink. It also interacts with some heart medications and blood sugar medications in ways that are predictable but require monitoring. Most critically, if you are on insulin, apple cider vinegar's blood sugar lowering effect may compound the effect of your insulin dose and cause hypoglycemia. Low blood sugar, especially in people over 60, can be dangerous and even life-threatening. This requires medical supervision. Here is the exact protocol based on the clinical evidence. Step 1. Choose the right product. You want raw, unfiltered apple cider vinegar that still contains what's called the mother, the cloudy, stringy sediment at the bottom of the bottle that contains beneficial enzymes, proteins, and naturally occurring bacteria. The most widely available brand meeting these criteria is Bragg's Organic Apple Cider Vinegar with the mother. You can find it at Walmart, Target, Kroger, Whole Foods, CVS, or on Amazon. It typically costs between $5 and $8, and at the doses used in research, a bottle will last you several weeks. On the label, you want to see the words raw, unfiltered, and with the mother. A clear vinegar with no cloudiness has been filtered and lacks those beneficial components. Step 2. Dilute it correctly. Every single time. Never drink apple cider vinegar straight. I cannot emphasize this strongly enough. Undiluted vinegar is highly acidic, with a pH similar to lemon juice but with more erosive potential at the concentrations found in apple cider vinegar. Drinking it straight can erode your tooth enamel over time, irritate or burn your esophagus, and damage your stomach lining. The dose used in the studies was 1 to 2 tablespoons, that's 15 to 30 milliliters, diluted in a full 8-ounce glass of water. Start with 1 tablespoon. 1 tablespoon in 8 ounces of water is what you want for your first 4 weeks. If you tolerate it well with no throat irritation or stomach discomfort, you can consider increasing to 2 tablespoons at week 5. If you ever feel burning or discomfort in your throat or stomach, reduce the amount. The goal is the benefit, not toughing through pain. Step 3. Drink it at the right time, in the right way. Take it first thing in the morning, on an empty stomach, approximately 15 to 30 minutes before your breakfast. Use a straw if possible to minimize contact with your teeth. After you finish the drink, rinse your mouth with plain water. Do not brush your teeth for at least 30 minutes after drinking it, because the temporary softening of tooth enamel from the acid means brushing immediately can actually cause microabrasion. This is a small but important detail that many guides leave out. Step 4. Track your numbers. If you have a home glucometer, a blood sugar monitor, check your fasting blood sugar each morning before drinking and before eating. Write the number down, along with the date. Do this consistently for 8 to 12 weeks. You are looking for a downward trend. Not necessarily a dramatic drop in week 1, more likely a gradual improvement across weeks 4 through 12. Think of your first 2 weeks as your body adjusting to the new input. Weeks 3 through 6 are typically where people start seeing the beginning of a trend, and weeks 7 through 12 are where the trend becomes clear enough to be meaningful. If you don't own a glucometer and you have diabetes or prediabetes, it's worth investing in one. They are available without a prescription at any pharmacy, CVS, Walgreens, Rite Aid, for typically between $15 and $30 for a basic model. The test strips are an ongoing cost, usually around 20 to 30 cents per strip. Many Medicare Part B plans cover glucometers and test strips for people with diabetes. Ask your pharmacist about this if cost is a concern. At your next doctor's appointment, bring that handwritten log or show it on your glucometer's memory. That data gives your physician something concrete to evaluate and builds a real conversation about whether this approach is working for your body specifically. Step 5. Realistic expectations and timeline. In the clinical trials, meaningful improvements in fasting blood sugar showed up within 4 to 8 weeks of consistent daily use. HbA1c changes take longer to register because that number reflects a full 3 months of blood sugar patterns. Give it a full 12 weeks, 3 months, before assessing the impact on your HbA1c at a lab draw. Consistency is everything here. Taking it 3 days, skipping a week, taking it again for 2 days, that won't produce the results the studies showed. The results come from daily, disciplined use over weeks. Here is the final bottom line. A simple morning drink. 1 tablespoon of raw, unfiltered apple cider vinegar with the mother diluted in 8 ounces of water, taken 15 to 30 minutes before breakfast, has been shown in multiple clinical trials and a rigorous 2025 meta-analysis to significantly reduce fasting blood sugar and improve HbA1c in patients with type 2 diabetes. The mechanism is biologically sound. Acetic acid slows carbohydrate digestion, improves insulin sensitivity in muscle cells, and appears to reduce the liver's overnight glucose release, specifically targeting that frustrating morning fasting number. Additional research shows potential cardiovascular benefits, including reductions in LDL cholesterol. It is not appropriate for everyone. It is not a replacement for medication, and it must be implemented correctly and with your doctor's knowledge. But for the right person, used consistently and safely, This is one of the most evidence-backed, low-cost, accessible tools available for morning blood sugar management. Now I want to hear from you in the comments. Drop the word trying if you're going to commit to this for 8 full weeks. Share your current morning fasting number if you're comfortable. This community is a safe place, and your number might help someone else feel less alone in their struggle. Or comment sharing if there's someone you love who is fighting this same battle with blood sugar. Every comment you leave helps this information reach more people who genuinely need it. If this video gave you something real, please subscribe and hit the notification bell. Next week, I'm covering something that surprises almost every patient I see. The one breakfast food most seniors believe is a healthy choice for blood sugar, but that recent research shows consistently raises fasting glucose in people over 60. It's in most of your refrigerators right now. You'll want to know before your next meal. I'm Dr. Sarah Mitchell. Take care of yourself, and I'll see you next week.